Welcome back into Talking Fitchburg. Joining me today from Fitch-Rona EMS, it's our Deputy Chief, Jeff Dostalek.
Good morning.
Welcome back.
Thank you very much. I'm glad to be back.
Glad to be here. And it's sort of like we're picking up where we left off with falls.
With falls.
I feel like the last time we talked was falls.
Yes.
And here we are talking about falls.
Yep.
And falls, pretty big deal. It was identified a long time ago in the EMS world. Dane County even, Safe Communities has a falls task force. There's a lot of things that go into falls, but falls are still on the rise and falls still happen day to day. So today we're going to break it down a little bit about where we're at as far as the state, Fitch-Rona district, and kind of prevention. So as we look at this, Jeff, from statewide, falls are going up. It's just there. It's happening.
Yeah, it's astronomical the amount of falls calls that us as an EMS agency and EMS agencies in Dane County go to on a daily basis. So Wisconsin was identified as having the highest falls death rate in the United States. So just think about that for a second. And Dane County, obviously being one of the biggest counties outside of Milwaukee County, our falls rate has gone up dramatically as well. Somewhere between 13 and 17% of our calls that we go on as a county fall within the categories of fall-related injuries. So we need to make a change on how we view falls and how we put prevention materials out there. And that's the reason why I wanted to come in today to talk about that.
Yeah, as I look at this report from 2019 through 2022, it's increased almost 25,000 falls. And the report in 2022 had it at 130,910 falls compared to 105,000 in 2019.
Yeah.
It's just startling.
Yeah, when we look at what we respond to every day, and the chief puts out his chief's report monthly, falls and sick person tend to flip back and forth. And obviously during COVID, sick person was, on the top of the list because that's where COVID-related calls came in, were coded as. But most of the time it is falls and falls-related injuries. And the concern, which really has kind of prompted a lot of things in the county, including the county executive putting additional money in the budget, is that the UW also identified falls as a priority for them, simply because a lot of the injuries coming into the trauma center were taking up resources were falls-related injuries. And so that takes away from some of the other trauma-related events that happen in the county. And so they started talking about adding staff and expanding the hospital simply because of falls. And so how can we prevent those from happening? Now, obviously people are going to fall and there's some things that we can't control. But are there things out there that we can control from a first responder level that we can drop information to patients and help them with things in their home and try to prevent a secondary fall? And that's what we're going to try to do for the rest of the year and moving into next year.
Yeah, and if you take a look at the data when we're talking about private resident versus nursing home, because you're like, okay, so where is this happening? Well, it's happening in the homes, especially. So the homes, the number in 22, 79,000, plus falls at home versus 16 at a nursing home, which you're like, well, hopefully you're not, but falls happen, as you say. But when you're thinking if it's happening at home, what can we do at home to prevent the fall, right?
Right. Well, and one of the goals that we've set for ourselves, and we've trained some of our staff on this, is when we go into a house for other types of calls, such as shortness of breath or chest pain or diabetic or whatever it may be, can we be observant enough to see that an older adult may need some help taking care of steps that may be broken or rugs that may be coming up at the seams or grab bars? And can we identify some of those in a brief 10-minute encounter with them that can be sent to me? We can go out and do a home inspection and try to take care of some of those things so that we don't go back to that patient in the future for a fall, or if we've been there one or two times for fall-related calls, that we can try to stop that from happening a second time. So maybe that older adult falls, they're not injured, we don't transport them, but if we don't identify the things that caused them to fall or why they, why they had some of the issues they had, then we go back, 2 weeks later, and maybe the outcome isn't as great. And so I tell this story a lot about my mom, and my mom was someone that didn't listen to her son, the paramedic of 30 years, right? And my mom, I kept telling her about using the resources available to her, a walker, a cane, things that can help her grab bars. And she was adamant about not doing much of that. And she fell and broke her hip. And being the really good son that I was, I didn't say, I'm sorry that you're in this situation. I said, I told you so, Mom, because I don't want you to get hurt. And she got hurt. So it's really kind of a passion of mine for that reason, for a lot of reasons, but for many reasons, that one is the biggest one for me, is to try and prevent those from happening and that suffering people go through.
Maybe to put even more light on that, you started off the interview with saying Wisconsin has the highest death rate from falls. A fall occurs, and it varies for ages. We have the data to show that it varies for ages. But ultimately, one fall starts the progression of many different things, right? So if it starts with a hip injury, and all of a sudden now you're laid up for a long time, and now you're not eating healthy, or now you're making
Right.
things worse progressively, potentially because of a simple fall, right? And that's what we're really talking about here.
Yeah.
We want you not to fall, but you got to recognize too that if you don't use those items to help assist you in different ways, and I've heard this many times from people in my own family too, that are like, I'm not going to use a walker, I'm not going to do.
Yeah, it was a stigma for my mom. Like, it makes me feel old using a walker. I said, I understand, but using a walker helps prevent you from falling. And even if it's just simply moving from their couch to the kitchen through a transition of a hallway, having that steadiness of having a walker in your hand or a cane or something to help you prevents you from falling. And there are statistics out there that say falling and breaking your hip results in, a death rate of whatever percentage because of the broken hip, which might not be coded as a fall-related death, but a broken hip, right? And so, and a lot of times, it's not that first time that somebody falls. It might be the second or the third time that somebody falls. And so we want to try and do what we can to reduce the number of falls that we have across the state. But my concern is with our district here and taking care of our residents.
And we do have statistics in here, so for Fitch-Rona's EMS district. So obviously age can be a factor, and so you might think, well, this is just affecting old people. No, not necessarily. The highest rate is in the 70 to 79 category, but still, the multifamily home apartment, that's where these falls are happening. And single home families too. I think too is, and we hear this from the senior center too, and Senior Center Cross, is you want you to age in place, right? You want to
Right.
stay at home, but you also got to recognize too, again, if you're going to do that, you got to make some changes in the home. So if people want to get in contact with you, I think that's kind of where this is transitioning to.
Sure.
I've heard you mention some things about home assessment and beyond, but for those who are interested to learn more about fall prevention, you can set people up with some great information, but
Sure.
also just coming out for a visit, it's not that you're mandating to say you should do this, but you're trying to help prevent a fall.
Yeah. So on the Fitch-Rona EMS website, there's a bunch of information from Safer Communities about fall prevention, the Age Better, Safer at Home organization who does go out and do free falls assessments. If you are interested in having either us or one of those organizations come out and do an assessment, you can send me an email. I set up a special email. It's communityparamedic@fitchronaems.com. And I will contact you, so put your contact information in there, what you're actually looking for, and then I will reach out and we can talk about what the expectation of a home assessment is. We're very fortunate in that the Dade County Executive put in his 2024 budget some money for falls prevention, and we were able to secure that grant through the county. That money is used to help residents that may not have the means to make some of those adjustments. So there's lots of resources out there. And our hope is that we can help facilitate you working through those resources. And then if there is an opportunity to put grab bars in or fix drugs or whatever, and there are no resources available to you, we do have money available to help with that. So that's our goal, is to make sure that people don't fall, to get that information out. And our website has a lot of that information on there, or you can just send me an email on that email address and I will contact you.
And it shouldn't be assumed that falls are a part of life, right?
Yeah,
I can't remember. Safe Communities always they said it in a good way. It's like falls, falls, it should be a part of your life. I mean, it shouldn't just assume as you get older, you're just going to fall. Like,
yeah,
it shouldn't be a thing.
Well, I thought that too until I fell. But yeah, falls are, I mean, it happens, and, a lot of times for a lot of different reasons, we'll fall, but the best thing that we can do is get prevention information out there. There's lots of resources on falls prevention. There's stepping on classes in the county that are provided all the time. Some of those classes do have a fee attached to them, but I know, talking with the people that organize that, they're willing to work through some of that stuff. We understand transportation sometimes is an issue in getting to those classes, but they're trying to open it up to a more broader area in the county, so to make that objection of going a lot less. The Wisconsin Institute for Healthy Aging has a website. The CDC has a bunch of stuff. And certainly the Safer Communities information is on our website. You can go there.
All right, Jeff. Well, I appreciate the update, and we'll look forward to checking back in with you real soon. And,
Thank you.
Don't fall.
Don't fall.